you're going to compare bilaterally for all of these tests. So the first one is the tap test, and it's for fracture, and a positive is pain. And what you're going to do is you're going to take 2 fingers and tap wherever pain is. So if it's on the second metatarsal, I'm just going to tap on the metatarsal. Did you have pain?
No.
Alright, it's negative. Alright, the next test is the distraction test, and this is for a fracture, and a positive is pain. So you're going to stabilize right below the joint, and then you're going to, so if I'm doing this for the second metatarsal, I'm going to take it, I'm going to pull and do a little twist. Do you have any pain?
No.
Lovely. Alright, so the next one is compression of the forefoot, and this is for pain. Nope, this is for a fracture or interdigital neuroma, and a positive is pain. So I'm going to stabilize. Nope, this side, because that's your boo-boo foot. I'm going to grab it and squeeze. Do you have any pain? Alright, lovely. Alright, the next one is compression at the fifth, and this is for a Jones fracture, and a positive is pain. So I'm just going to stabilize your foot, compress at the fifth. Do you have any pain?
No.
Lovely. Next is the weight bearing, neutral position of the talus. So it's for neutral position of the talus. And a positive is if there's a bulge on either side. So I'm going to find your talus right here in between my fingers. And then can you twist your torso side to side, please? And I'm just seeing if there's a bulge on either side, and then stop. And seeing if the bulge is still there. The end. So next is neutral position of the talus, and it's testing for neutral position of the talus, non-weight bearing. And a positive is a bulge on either side. So I'm going to find her talus in between my fingers. Then I'm going to crank her into dorsiflexion, and then invert and evert. And I'm testing the bulge on either side, making sure they're even, and then when we stop, making sure that that goes away. You flip over. Next is long heel alignment, and this is for hindfoot, valgus, and varus, and a positive is if there's a greater than 2 to 8 degree difference. So I'm going to find the musculotendon junction, make a mark, go down an inch, make a mark, find where her Achilles attaches, make a mark, go down a centimeter, make a mark, and then if the lines cross or are 2 to 8 degree more difference, then it's positive. So the next is tibial torsion sitting, and it's for tibial torsion, and a positive is if there's a greater than 12 to 18 degree difference. So I'm going to find the apex of her malleoli, and then I'm going to look right down her knee and see if there's greater than that difference in the position of the malleoli. So next is too many toes, and this is testing for tibial torsion, and a positive is if there's an uneven number of toes on one side or the other, like one side versus the other. So she's going to stand with her facing away from me with her feet shoulder length apart, and I'm going to kneel down right behind her and see how many toes are on each side, and if it's uneven, then it's positive. So this is the anterior drawer, and it's testing for an endpoint of the talus, and if the foot everts, then it's ATF and CF, and if it inverts, it's deltoid. So I'm going to stabilize her foot, find her talus, and then I'm just going to pull up and go back down. Beautiful. Cute. And then anterior drawer supine is testing for the same thing, same positive. So I'll use this foot. So stabilize again, find it. Same thing, beautiful. So next is talar tilt, and I'm going to have my patient side lie, and this is for a talar tilt, and a positive is excessive movement, so I'm going to stabilize, and then crank her foot into inversion, feel an endpoint, and then, nope, that was eversion, feel an endpoint, and then inversion, and feel an endpoint. So next is the squeeze test of the leg, and this is for damage, and a positive is pain. So I'm just going to take my hands and push her tibia and fibia together. Do you have any pain? Lovely, that's a negative. Okay. Next is the compression test. So again, have her long sit, and this is for, again, interosseous membrane damage, and a positive is pain. and I'm going to go right above her malleoli and squeeze. Do you have any pain? Okay, next is the Kliger test, and this is for if there's pain medially, it's deltoid. If there's pain anteriorly, it's the interosseous membrane, and then if it's laterally, it's a bone bruise. So I'm going to stabilize, crank her foot into eversion. Do you feel any pain? Lovely. After that is a Thompson test, so will you turn over? Okay. And this is for an Achilles rupture, and a positive is if there's no plantar flexion. So I'm just going to squeeze her gastroc, and her foot plantar flexes a little bit, so that's a negative. Turn around. Next is the figure 8 measurement, and this is for swelling, and a positive is greater than 2 centimeter difference, so I would compare this bilaterally to get that difference. Can you go towards me just a little bit? So I'm just going to make a figure 8 with the tape. Great. And then I would compare that number to what I would get bilaterally. The end.